If you are one of the many people across the world who are struggling to shake the effects of carpal tunnel syndrome, I would like to show you what you may unknowingly have been missing all this time. I know that having carpal tunnel can be frustrating and quite debilitating for some. And as a physio, I have the privilege of working with people to try and figure out why their symptoms are there and ultimately what they need to do to improve their symptoms and stop them from coming back again. But based on my experience, there are certainly some things that I think we can do better as an industry. One of which is respecting what's going on here, but also understanding that this is a part of a bigger system. And if we're not taking a step back to consider more things, then it might be hard for us to explain to you why it randomly got sore, why it isn't going away despite your best efforts. And as a quick spoiler, if anyone has ever told you that your carpal tunnel syndrome is due to age or use or overuse, then they are missing the bigger picture. If for no other reason than getting older and using your hand, wrist and forearm is normal. So what I'm going to go through specifically in this video is I want to talk to you about the concept of why carpal tunnel develops and what you can do to resolve that hopefully long term. I'd like to talk about the nerve glides and give context to why they may be helpful for some people but not for others. And then if you're a member of the channel, I want to go through two really simple stretches that you can add to your carpal tunnel rehab to hopefully round out some of the concepts that we're going to talk about. But more importantly, let's start to dive into how I see carpal tunnel and what I think you might be missing and allow you to start feeling and functioning better. So one of the real challenges that I think people face when they're dealing with carpal tunnel syndrome is we often don't give you enough perspective to truly understand what this is and why it's there. And just to be clear for those unaware, carpal tunnel syndrome essentially refers to an anatomical space in the body called the carpal tunnel. There's a ligament that crosses from one side of your palm to the other, and underneath that runs a lot of vessels and nerves that supply the hands and fingers. That nerve is the median nerve, and if that nerve becomes irritated and overloaded or swollen or compressed and the space decreases, we may start to see some neural symptoms go down into the hand and fingers. Pins and needles, numbness, tingling, weakness are often classic symptoms associated with something like carpal tunnel. But the trouble that we run into is that because the symptoms are in this area, it's very easy for us to become narrow focused and focus just on those symptoms. And this is often highlighted by two of the most common ways to treat carpal tunnel syndrome. The first is splinting, where we splint you in a certain position to take some of the tension off that, and we leave you there for a period of time. Secondly, if you are someone where it's progressed enough or it's been there for long enough, we may opt for surgery to release that a little bit to feed some slack into the space and help your symptoms that way. But the important thing I wanted to get across about this and anything else that you may have been asked to do for this particular part of your body is that treating this area is likely just a symptomatic treatment. It's not necessarily fixing the cause of why those symptoms are there in the first place. So the perspective that I want to give to you today, if you don't already have it, is that we need to look beyond the wrist. If we know that the median nerve is the main nerve associated with the carpal tunnel symptoms, if we just followed the course of that nerve back through your arm to your armpits, where we ultimately arrive is we arrive back at the spine, more specifically the base of the neck and the top of the upper back. The median nerve essentially starts from the nerve roots in those areas. And what carpal tunnel syndrome often is for a lot of people is accrued neck and upper back dysfunction that may pull a bunch of slack out of the nerve or cause some neural dysfunction that then makes this vulnerable to become an issue. So again, if we're just treating this and splinting it and massaging it and stretching it and operating on it, if we're not also looking at what's going on closer to your neck and upper back, then we may absolutely never truly understand what led to this becoming a problem in the first place. And if you have persistent carpal tunnel symptoms that despite your best efforts, it's just not going away. If you haven't looked at the things we're about to talk about with your neck and upper back, you could be missing something huge. So what I want to go through is I want to take the standard ball exercise that we do a lot on the channel. We want to go hunting through the joints and the tissue at the base of your neck and the top of your upper back for anything that feels stiff, tight, restricted, overloaded, potentially tender, but maybe not even tender for some people. And then we want to show you how to use that same ball to free up those areas to hopefully feed some slack back into the system to give this a chance to go away. So before we get to this exercise, what I will always ask you to do is do something, perform a movement, do an action, do an activity that alerts you to how your carpal tunnel symptoms feel right now. Take a mental picture of exactly how that feels, because once we've done this exercise, we're going to get you to do the exact same thing again to see if anything meaningful has changed. So the way that I'd like you to do this, take a lacrosse ball, tennis ball, baseball, cricket ball, doesn't matter what it is. We just want something that you feel feel is respectful enough to push into your spinal tissue. And as always, you're going to take that ball. A great place to start is always the biggest bump at the base of your neck. This signifies the junction between your neck and your upper back. We're obviously going to creep higher and lower than this to go looking for all the dysfunction that might be there. But take the ball, start on the bump in the middle, and then just immediately let it roll off to one side. And from here, we're just going to get you to lie down on top of that and let your head rest. You may need to turn your head and your body a little bit to the side that you're on just to make sure you've got a good connection. Take note of how this feels. More specifically, not so much how tender or sore it feels. We want to respect it, but that's not what we're looking for with this exercise. Instead, we want to take note of how hard, tight, thick, restricted, dense, stiff this spot feels when compared to the exact same spot on the other side. Because what you will find is that one side will feel like the ball sinks in easier. The other side will feel like it's a little bit harder, a little bit more restricted. That is the side that we're looking for. Those are the levels that we're looking to try and mobilize and free up. The exercise is just leaving the ball here for 30 seconds, a minute, 2 minutes, 3 minutes, whatever you feel is necessary until you feel like it starts to soften a little bit. And once you've done this, you can move the ball up a little bit or down a little bit, but just systematically work your way up and then systematically work your way down, paying attention to anything that you feel is important, restriction-wise, not necessarily tenderness-wise. It's certainly common for people to have all of their tenderness and their restrictions on the same spots. That's convenient, but just make sure you're not part of the other subgroup of people who have their tenderness on one side, but most of their restriction on the other side. But as I mentioned, do your movement or activity that alerts you to your symptoms. Systematically work up and down your neck and upper back as far as you feel you need to, double checking which sides feel the most stiff. Then immediately recheck your symptoms again to see if anything is meaningfully changed. If you found a whole bunch of stiffness and tightness and you improve that and your symptoms then improve as well, you have just found potentially the most important missing piece of the puzzle that you may never have noticed if you just focused on your wrist the whole time. We still need to do anything that you feel gives you positive results to your symptoms, but I want to keep encouraging people to pair that up with a broader perspective to try and understand why we're needing to do these things in the first place. Often the reason why these parts of the neck and upper back become dysfunctional comes back to the boring stuff of that's just where you load up your neck and back when you're doing the things that you do the most throughout the day. If you're someone who works at a desk, if you have a stationary job where you're standing looking down a lot, or you just sit down and relax on the couch and use your phone or an iPad or read or play an instrument in a position where you're hinging through your neck or rounding out through your shoulders. Sustained positions like this isolate an increase in load in those areas, and then over time, days, weeks, months, even years, your body's having to adapt to that change in load. And all of a sudden, anything that may associate with those spinal segments can then be set up for failure down the track. And so with all that in mind, the next thing that I'd like to go through with you are some nerve glide exercises to see if that may help your symptoms as well. So if you've sought treatment for carpal tunnel syndrome before, you may be familiar with what we call nerve gliding exercises. And the idea is that we do certain movements with our wrist, and we can include our head in that conversation as well if we want to, with the view of trying to slide and glide the nerves through all the channels that they pass through in the hope of freeing them up. These can be important because we ultimately can't stretch neural tissue. It's kind of like a steel cable that runs through a lot of different tissue. So while we can't stretch that tissue, we can certainly ask it to slide freely through the tissue that it should slide freely through if everything is normal. And I had a patient recently who had been given them over the course of the last 15 to 20 years, and she wasn't necessarily happy with it because she didn't necessarily feel like it was doing anything. But now that we're talking about carpal tunnel syndrome through the lens of potential neck and upper back dysfunction, there is a world that if you are quite tight and stiff at the origin and the nerve comes down through there, if this remains stiff and you're doing your gliding exercises, it may not be enough to shear that free or free that tissue up. But now that we're starting to free up the origin of that nerve, it may then make doing a nerve gliding exercise for that median nerve even more effective. So I want to make sure that you're doing it in a way that you feel may be helpful, but also pairing it up with the ball exercise to make sure that it is freeing up the origin and giving it the best chance to actually be helpful for you. So how I'd like you to do the nerve glide is if you can have your arm out to 90 degrees with your palm up. We do want to wind you up a little bit to pull as much slack out of that as possible. Up tall in a good posture. If you just bend bend your wrist back, potentially with your fingers straight if you can do that. You should feel a whole bunch of neural tension potentially end up in the palm of your hand. If you have carpal tunnel syndrome and your symptoms are quite irritable or sore at the moment, please be gentle when you do it. But essentially what we want to do at a very simple level is keeping this position. We can just get you to bend and flex your wrist to shear free that neural tissue where it tensions up, the tension comes off. Just like we're flossing a piece of floss through our teeth, we can do something that allows that to shear free that tissue. If you want to wind it up a little bit more, what you can do is you can gently take your head away to again increase the tension on the system and then do the same thing. If things feel a little bit too awkward for you, you can certainly bend your head towards that to feed more slack into the system, which may mean you can bend your wrist back more than you could before. But we want to do sets of 10, sets of 15 of just gently gliding that tissue through all the channels that it passes through, and then reassess your symptoms afterwards to see if anything meaningful has changed. Freeing up the origin of that nerve is a must, but then pairing it up with a nerve glide may then become even more powerful if you find that there are some more local restrictions along the course of that nerve. And following on from this, if you are a member of the channel, I just want to go through 2 really simple neck and upper back stretches that you can add into this to also see if we can find and eliminate some of the unnecessary muscular tightnesses in those areas. So at the end of the day, carpal tunnel syndrome can be such a challenging and frustrating condition for someone to have. And unfortunately, from what I see clinically, that can be emphasized even more if we're missing the bigger picture of what carpal tunnel is and what you may need to broaden your focus to give it permission to go away as quickly as it's going to. I want to reinforce that all the carpal tunnel specific treatments that you may have tried, whether it's splinting or stretching or massaging or strengthening, and even surgery or injections and things like that, they all still have a relevant place in the management of treating carpal tunnel syndrome potentially. But as someone who is passionate about trying to understand why all this is here, if you aren't also pairing that stuff up with a look at trying to improve the function of your neck and upper back, which includes freeing it up, potentially getting it stronger, but more importantly, improving the postures and the shapes that you put that area into the most throughout the day, then it may be unreasonable for this to go away as quickly as possible. But as I mentioned up the top of the video, please don't trust me. We want to base this on results, because for the literal millions of people who may be dealing with carpal tunnel syndrome, please try and take a broader perspective on what's going on, because if you can, and you can find some of the hidden things that you didn't know were contributing to this, then your path through this frustrating condition may suddenly open up, allowing you to get through this a lot faster with less hassle. So as always, thank you again for watching. If you enjoyed the video, if you found it helpful, please consider leaving a like. Subscribe to the channel if you do find this information helpful. Please consider becoming a member if you want more depth to these conversations. But as always, I genuinely hope that that was helpful. I hope to see you next time.